And you mentioned systemic testosterone. What role does systemic testosterone play specifically in the EDS patient population? And how does low testosterone impact maybe what you're seeing in the treatment room?
Absolutely. So this is local, right? Like we talked about local testosterone, meaning vulvovaginally. And so what we see systemically is that, women, we have 4 times the amount of testosterone than estrogen, but yet it's so gendered that nobody ever thinks about it for women. So I want to invite us all. This is an opportunity to really think about how helpful testosterone can be, because testosterone is essential for collagen synthesis, fascia integrity, and lean muscle mass. And in EDS, ligaments are lax, so they can't hold the joints. So what you'll see like in your PT sessions is like it just doesn't hold. Like you think you've gotten your patient to a certain point as a PT, and then like you just don't see the progress anymore, right? So when we think about from a mast cell activation perspective, human mast cells contain androgen receptors. And when they're engaged, testosterone can inhibit mast cell degranulation and calm the inflammation. So when people have low testosterone, it almost acts as a trigger for the mast cells. So, it's something that I think we're just not thinking about enough. And when we think about autonomic function, dysautonomia POTS, right? Testosterone contributes to healthy circulation, blood pressure regulation, and overall energy. And so if we optimize the testosterone, we might very well help in partnership with many of the people on this call to improve orthostatic tolerance. And then it's also going to help when we think about pain modulation and we think about the longitudinal data that we have on these hypermobility and EDS, the hypermobility spectrum. Hormonal drops correlate with increased pain sensitivity. And then exciting when we think about, I'm going to go back to the local application. When you look at this big data set, the NHANES, the big, huge data set, they found lower testosterone levels have significantly higher odds of overactive bladder. The tissue of the bladder and this vestibule are hormone dependent, right? And so that's where that local tissue health, like it really optimizing the local hormonal tissue health can be so, so important. I'm not saying it's for everyone. I just think we're completely ignoring it. And it's a tool we have in our toolbox that pairs so beautifully with everything that all of us on this call do.